Health is something we should all take seriously. We have to be very careful about what we eat, how we live, everything. From smoking to stressful life and unhealthy food we eat. Unfortunately, we do not care about the things that affect our health. In this video, we will talk about some of the symptoms. If you have these symptoms, it means that you are at risk of developing pancreatic cancer. If you ignore these symptoms and the disease progresses, it will unfortunately cause you to lose your life in a very short time. Experts diagnose the vast majority of cancer cases already at a late stage because the symptoms often overlap with other conditions such as indigestion and irritable bowel syndrome. The pancreas is one of the most vulnerable organs of the body, a sponge-like structure about 15 centimeters long, located transversely behind the stomach. The pancreas, which is responsible for secreting various hormones and enzymes, is responsible for regulating blood sugar with its internal secretion insulin and the digestion of food in the duodenum with its external secretion pancreatic juice. If these hormones do not work properly, diabetes develops. Pancreatic cancer is caused by the uncontrolled proliferation of cells in the pancreas. The World Health Organization has announced that the number of cases diagnosed with pancreatic cancer in 2020 covers a 2.6% slice of all cancers. Although this figure is not very scary, it can be very difficult to catch pancreatic cancer, which is difficult to symptomatize due to its location in the early period. Late detection of cancer can negatively affect the success of treatment. This is why keeping up with routine medical checkups plays an important role in the prevention of pancreatic cancer, just like other types of cancer. And now, let's come to the answer to the question you are wondering. If you have these symptoms, you should definitely see a specialist doctor. So which ones are these? Attention to itching without jaundice, weight loss without diet. Since the size of the tumor is very important in terms of intervention in pancreatic cancers, early diagnosis is vital. For this reason, symptoms that are seen as routine health complaints in daily life should be taken into consideration and a physician should be consulted. Pancreatic cancer is a very insidious disease, and its symptoms can sometimes be in the form of vague pain and sometimes indigestion. Clinically, itching without jaundice, weight loss without dieting are the most important early symptoms. For this reason, sudden onset of diabetes type 2, itching, loss of appetite, weight loss, and abdominal pain should be taken into consideration. We said indigestion or heartburn can be a common symptom of pancreatic cancer, but it's one that most people wouldn't think is linked to a serious illness. Most of the time, people can take over-the-counter medicines for persistent indigestion, but there may be times when other symptoms, such as white back pain in your abdomen and a few other annoying things that could indicate pancreatic cancer, occur. Attention to abdominal or back pain. It can be anything from a dull ache to pain radiating from your abdomen to your back. If you are a woman, it can be around the bra line, not lower back pain, and it usually happens between the shoulder blades. It can be worse after you eat something and doesn't go away easily. Loss of appetite. Weight loss is sometimes associated with loss of appetite, another pancreatic cancer symptom that is easily overlooked, at least initially. It can range from people thinking they are not really that hungry to having no appetite at all and not confronting food or feeling full after eating very little. Jaundice explains that jaundice is a symptom of pancreatic cancer that is less easy to ignore but tends to occur only in people whose tumor is towards the head of the pancreas. Not everyone with pancreatic cancer will get jaundice, although it is very common. It is a red flag symptom that you may notice when the whites of your eyes turn a little yellow before your skin starts to take on that yellow tint. Another symptom is itching. Before jaundice develops, your skin can be incredibly itchy because first the bile dust accumulates under the skin. This is emphasized by the fact that it itches like crazy, not to mention the minor itching that causes you to scratch like crazy. Change in bowel habits. This is a very important problem because there are many causes of diarrhea. But this is what we call staturia. When there is fat in the stool, this causes the stool to turn a yellowish color, which also happens in jaundice. This oily yellowish stool that doesn't go away is a sure sign that there is a problem higher up in the digestive system. If the patient doesn't describe the characteristics of their diarrhea, time can be wasted in diagnosis, and time is really of the essence here. Recently diagnosed diabetes. It is important to warn that a very small number of people who have recently been diagnosed with diabetes may have pancreatic cancer, because cancer can stop the pancreas from producing enough insulin to cause diabetes. If you have some of the symptoms of pancreatic cancer and you have suddenly been diagnosed with diabetes, it should be a red flag for your doctor to consider whether you need a scan to check your pancreas. Nausea, people can sometimes vomit, but this is not as common as feeling sick. Feeling sick or being sick can be another sign of pancreatic cancer. Blood clots. Blood clots are a rare symptom of pancreatic cancer and can occur, for example, in people who are younger and non-smokers, and therefore not typically at risk of clots. They may present with shortness of breath or a swollen leg and go for a screening and find out they have pancreatic cancer. Fatigue. Fatigue can be caused by many things, of course, but if you have other symptoms, you need to be careful that this could be linked to pancreatic cancer. This can be another symptom of pancreatic cancer when combined with some other symptoms that physically drain a person, such as ongoing pain or steathora, if you cannot rest and recharge your batteries. Fever, chills, and feeling unwell. Such symptoms are rare symptoms of pancreatic cancer, but not unheard of, and may be linked to the cancer itself, or possibly to an infection linked to jaundice. Difficulty swallowing food. Cancer makes a person feel full, so they think the problem is with swallowing, but it's usually because they can't fit the food in. It doesn't actually cause problems with the esophagus, it just makes swallowing feel abnormal. Depression and anxiety, for no apparent reason, is a common symptom of pancreatic cancer. It's not something that on its own would lead you to say that you probably have pancreatic cancer, but low mood can go hand in hand with pain and fatigue. Again, now I want to give you the answer to an important question. What are the symptoms of pancreatic cancer end stage? An uncomfortable pain in the abdomen when you lie down after a meal. Gas pains increase more than usual and lead to swelling, loss of appetite occurs, and the person does not want to eat. Frequent vomiting is observed. Darkening of the color of urine occurs. Some patients may complain of bloody urine. The person feels constantly sluggish in the last stage of pancreatic cancer. The gallbladder and liver begin to enlarge. Varicose veins occur. Manifests itself in complaints of itching. In most people, communication occurs strongly, and patients have difficulty expressing themselves. People do not want to move and want to lie down all day long. This is a problem that develops because pancreatic cancer causes fatigue, irregular heartbeat, occurs, convulsions appear in various parts of the body. Most people have respiratory distress, which leads to difficulty breathing in and out. And I would like to answer one last question. What should we do to prevent pancreatic cancer? Make sure you do these 3 things. Most importantly, quit smoking if you smoke. Talk to your doctor about strategies that can help you quit, including support groups, medications, and nicotine replacement therapy. Maintain a healthy body and weight. If you are at a healthy weight, try to maintain your body weight. If you need to lose weight, set a slow, steady weight loss goal. Try to set yourself to lose 1 kilo per week. Maintain a healthy body and weight. If you are at a healthy weight, try to maintain your body weight. If you need to lose weight, set a slow, steady weight loss goal. Try to set yourself to lose 1 kilo per week. Choose a healthy diet. A diet full of colorful fruits and vegetables and whole grains will help reduce the risk of cancer. I will end the video here. Please do not forget to like and share the video. and subscribe to my channel by commenting so that it can benefit others. We wish you all a healthy, happy, and peaceful life. Goodbye.